Hi, I'm Health and Human Services Secretary Kathleen Sebelius, and I'm glad to get a chance to send this message to the Voices for America's Children annual conference. The organizations that make up the Voices for America's Children network touch the lives of children in every state and community in America. And I know that working with families, states, and communities to ensure that all children have health care coverage has been a long-time priority for all of you. That's why I'm so excited that the Voices for America's Children is taking up my Connecting Kids to Coverage challenge. This February, 1 year after President Obama signed the Children's Health Insurance Program Reauthorization Act, or CHIPRA, I issued a challenge to the nation to enroll all 5 million uninsured children who are currently eligible for Medicaid and CHIP within 5 years. And the purpose of this challenge is pretty simple. Even as the administration and my department are moving forward with health insurance reform for all Americans, we mustn't lose our momentum toward enrolling children in health coverage. Under the Affordable Care Act, every American will eventually get access to affordable coverage, but children don't have to wait. So we're asking states, local governments, other federal agencies, community-based organizations, health centers, faith-based organizations, and others to help us enroll all the children who are eligible for CHIP or Medicaid right now. As you know, the CHIPRA legislation gives states a number of new tools to help boost enrollment in Medicaid and CHIP. One of these tools is Express Lane eligibility. Now, under the Express Lane option, the information families have provided to other government programs, like nutrition assistance, can be used to jumpstart their enrollment in health coverage. That's just one of the ways that CHIPRA helps cut the red tape to help kids get health insurance. Another area where we can do better is bringing the application process online. Today, more than half the states offer some form of online application, but I'd like to see all American families be able to apply online and get an answer about their eligibility right away. Think about the peace of mind that could bring parents. The CHIPRA legislation also included $100 million to help fund outreach efforts, half of which we've already awarded to states, communities, and tribes across the country. Even in these difficult economic times, states have continued moving forward to find and enroll eligible children, to make the application process easier, and to keep kids enrolled in coverage for as long as they're eligible. And I know a lot of this progress is the result of your tireless efforts on behalf of children. Your unrelenting work to keep the needs of children front and center has resulted in so many states making children's coverage a priority. My challenge to you today is to raise this conversation to the next level, to identify the existing barriers and the opportunities for promoting coverage, and to encourage your state leaders to continue the progress toward our goal of enrolling those 5 million kids. Make them understand why even the smallest step can provide significant benefits to the health of children. Challenge them to invest in new or updated IT systems, which they're going to need anyway as health reform approaches. Push them to join you in being the voice for change in your community. I'm committed to this partnership. Cindy Mann, who you'll hear from in a few minutes, is committed to this partnership. And we'll continue to devote the resources and do all we can to support you in your efforts to connect children to the coverage they need. I believe that together, we can achieve the goal of enrolling those 5 million children. Have a great conference.